What's up, y'all? Welcome back to my vlogmas series. So today we're going to switch gears a little bit. We talked about entry-level healthcare administration professions. Whenever I say healthcare administration too fast, everything runs together, but it's okay. So we're going to talk about healthcare administration professions, but instead of talking about entry-level professions, we are going to talk about the other side of the spectrum, which is way more experienced professions that can make you a good amount of money. So we all know that whenever you first get started in healthcare administration, you're not really going to be seeing as much money as you could later on down the line. But we haven't talked about where you could go should you stick it out with healthcare administration and really work your way to the top of the food chain. Today we're going to talk about some of the highest paying healthcare administration professions and what some of those duties look like. Okay. As always, make sure you thumbs up this video. If anywhere throughout the video you feel inclined to leave me a comment down below, please do so I can respond to you. And look around on my channel. If you like what you see, then go ahead and subscribe and join our family. Okay, let's go ahead and get started. So the first and the most common healthcare administration profession that people typically think about whenever they think of a career in healthcare administration is a hospital CEO. Just like in a regular business, hospitals have CEOs as well. Sometimes they can be referred to as the executive director or the president per se. According to hospital CEO Michael Goldberg, as a CEO, you are responsible for the quality, safety, experience, care, community relations, and financial performance of the healthcare facility. So you're pretty much responsible for everything that's going down at that hospital, which makes sense because you are the CEO, you're the president. Everything kind of like falls on you in the same way that it would in any other kind of organization. How much are hospital CEOs making? This is an average, so of course you could be making more or less, but the average is $153,474 a year. So easily surpassing six figures. Hospital CEOs are very well compensated for the work that they do, which in my opinion is very well deserved. The next profession that I'm going to get into is a hospital CFO. I'm not going to spend too much time on hospital CFO. Actually, it's kind of like the CEO, except you're dealing with all the financial aspects of the organizations, making all the big financial decisions for the organization. Their annual salary clocks in at $154,399 a year. So very well compensated. Not something that I think I would be interested in because me and numbers, I mean, we can do it, we're gonna get it done, but the numbers and the financial aspect is, I don't think it's something that I would want to be responsible for. Next one that I'm going to talk about is Healthcare Chief Information Officer. This is a healthcare executive that manages all the information technology aspects of the organization. So essentially all the IT stuff is going to go through this executive. They make all the decisions and the future plans for the technology of the organization. So this could be a really great profession to look forward to if you're somebody who is really into IT. Healthcare Chief Information Officer is clocking in at $131,015 annually. Again, these are averages, just so you guys know. You could be making a lot more or a lot less. Next position we're going to talk about is a Chief Nursing Officer. So essentially a Chief Nursing Officer, I know it has nursing in the name, but it is a non-clinical administrative position. Instead of engaging in clinical work, the Chief Nursing Officer is going to oversee other nurses and oversee their implementation of care, essentially. And Chief Nursing Officers are clocking in at $129,572 annually. Just to clear up some questions about education requirements for this position, what it's saying is typically to hold this position you'll need a master's degree in either healthcare administration or nursing leadership. I'm sure the exact requirements will depend on the organization. Some people might let you do it with a healthcare administration master's and some people might not. It really just depends, I would say, on the organization and what they're looking for. Next position that I'm going to get into, I just kind of perked up and got excited because this is the one that I feel like I would be most interested in. Of course, we would have to wait and see because you never know where your experience could take you. But number 5 is going to be a hospital administrator. Hospital administrators work on both the business side of the hospital as well as working in long-term strategy and patient care planning for the hospital. And you know, if you know me and if you're a subscriber to my channel or if you watch some of my videos, you're probably going to be like, yeah girl, that sounds like something that you would like. And I really think this is something that I would enjoy doing. Hospital administrators also work in the community as sort of the face of the hospital, and they work with a lot of healthcare administrators from other hospitals whenever there's like collaboration happening and stuff like that. So hospital administrators typically make around $110,430 annually, which is another really great six-figure salary for you to look forward to if you want to go into that. The next profession we're going to talk about is a nursing home administrator, which might be something that you're really interested in getting into if you're really interested in long-term care. Nursing home administrator is responsible for overseeing like the day-to-day operations at a nursing home. They're also considered like the lead when it comes to like long-term planning for the nursing home. The national average for nursing home administrators is $106,184 annually. The next position we're going to talk about is a hospice administrator. Hospice administrators oversee facilities that specialize in end-of-life care. So if you've always been interested in making the end-of-life experience more comfortable for patients and, you know, kind of caring for their families, and this might be something that really interests you. Typically, people who are a part of this line of work have really great interpersonal skills. They are really great at empathy and compassion. They're just great at being a patient ally and a patient advocate. Hospice administrators typically make around $100,469 a year. So yet another great six-figure salary if that's something that you are interested in the long term. The next positions we're going to talk about are under six figures but still really amazing salaries. So the first one we're going to talk about, technically number 8 on our list of healthcare administration professions, is health clinic administrator. Health clinic administrator is very similar to the hospital administrator. I think the biggest difference is that instead of doing the line of work in a hospital, they're doing it in a clinic. So it'll look a little different in that it'll probably be a little bit smaller. It won't be as big and it won't have as many operations as like a hospital will. The health clinic administrator potentially could oversee something as small as like a local doctor's office. But me personally, I do think it would be like really great experience to put on your resume if, for example, hospital administrator was like your end goal, but you need some supervisory experience leading up to that. I think health clinic administrator is a great role for getting comfortable in a position of that caliber. Health clinic administrators typically make around $96,000 a year, which is clocking in at a little bit under $100,000, but still an amazing salary. I'm seeing here that health clinic administrators typically have some type of direct patient care experience first, and then after that they kind of lead into a managerial position. So kind of keep that in mind. I don't think that's like required. I think it definitely depends on where you are trying to work at, but definitely keep that in mind if you are somebody who is interested in a position like that. Position number 9 is a clinical informatics manager. The clinical informatics manager typically is the person who's going to find ways to improve the overall quality of the healthcare facility, and these managers typically make around $93,141 a year. Last one that I'm going to talk about today, and clocking in at number 10, is a government agency healthcare administrator. This is actually one that I wasn't necessarily familiar with, so I'm just going to read here what I have found about these professionals. It says these administrators work for government medical agencies such as the Department of Human and Health Services or a military branch. These positions can come with a lot of perks such as tuition reimbursement, insurance, retirement, and more. Of course, with government jobs always comes really good benefits, so I definitely believe that. It says instead of dealing with patient care efficiency and equipment budgets, you will be overseeing agency operations. Duties include managing agency-wide operations, planning for future governmental programs, overseeing budgets and staff. You may also be involved with community outreach, training, and speaking with the public, such as the updates that have been released during times of an outbreak. And it says that these professionals typically make on average $83,000 a year, but can also reach over $100,000 annually. So this might be a good role for you if your goal is to work for the government. If you want to work for the government agency, I know that's never a bad idea, especially considering the climate that we're in now. Government jobs are just a little bit more secure than civilian jobs are. So if working for the government is your end goal, then I'd say that that's a nice position for you to look into as well. Other than that, I feel like I've talked you guys to death enough. So if you like this video, make sure you hit that thumbs up button. Leave a comment down below if you have anything to say so I can answer to you guys. And of course, look around on my channel. And if you like what you see, then go ahead and subscribe. We are only 7 days into vlogmas, so we have a long way to go. We have a lot more videos and a lot more to talk about. So if you feel inclined to subscribe, go ahead and join our family so that you can be updated about all information related to healthcare administration. Love you guys. XOXO, Aniyah and Shay.